What is the likely risk of surgical wound infection? 23 years old male undergoing the elective inguinal hernia repair. So when there is elective inguinal hernia repair, how percentage there is chance of infection? Here the options are between the 5 to 10%, less than 5%, between 10 to 15%, more than 25%, and between 15 to 20%. We know there are different type of the wound, including it is clean, contaminated, and dirty wound. And here we can see this is the elective inguinal hernia, which is the clean wound. So in case of the clean wound, there the infection rate is very, very low. So in case of the clean wound, there is very low rate of infection. Now see the surgical site infection. The surgical site infection, it may occurs after breaching of the tissue. That means when any type of the operation done or when there is a accidental injury or any type of the injury of the skin, there is breakdown of the skin. In this condition, there is the chance of infection, and it allows normal commensal and other pathogen to initiate infection. So the injured skin or injured mucous surface, it invites the organism, and they are the major cause of the morbidity and mortality. Surgical site infection compromises up to 20% of the healthcare associations, and at least 5% of the patient undergo surgery will develop an SSI as a result. That means when there is a clean wound, at least 5% of the patient undergo infection. In many cases, organisms are derived from the patient's own body. That means when the on part of the body operation occurs, then from the side, organism may invade the injury site and may cause the disease. What measure we should take to increase the risk of, or what increases the risk of the SSI? That means surgical site infection. That is shaping the wound using a razor, using non-iodine impregnated incision dressing, tissue hypoxia, delayed administration of the prophylactic antibiotic, and use mesh in this setting. So here we can see there are different causes which may increase the surgical site infection, including tissue hypoxia without antibiotic use and use of mesh in these settings. So what are the risk factor? As it is the clean wound, so it is the less than 5%, and actually there is very minimum infection in case of the elective inguinal hernia repair.